Dentistry Day, a day dedicated to free dental care to veterans without dental insurance. One free extraction or cleaning will be provided per patient between 8 a.m. and 3:30 p.m. For more information, call 352-237-2262 or visit freedentistryday.org.
Ocala's information station, 1370 WOCA. Ocala!
All right, 25 minutes before 11 o'clock. Thank you for tuning in. A lot has changed in our world in the last few decades, and a lot has changed in the world of health in the last few decades, and a lot of the changes that we hear about all the time might sound well and good for you, but often you're confused because there are so many options now, so many choices, and my goodness, and insurance sometimes has rules about which doctor you can go see, which ones you can't see. Others don't have such rules on them, and you really have to know your own situation before you can really navigate your own health care needs. And if you have a family, it's ultra important. Sometimes, well, it's always ultra important, even for yourself. But I think you all get what I'm saying, is that a lot of times we would let our own health go, but you're never going to let your family's health go, is what I want to say. Dr. Leslie D. Michelson is on the phone. Dr. Michelson is the founder, chairman, and CEO of Private Health Management. He also happens to be an attorney. He's an informational speaker. He's on the advisory board of UCLA's Fielding School of Public Health. He's on the board of the ALS Therapy Development Institute, and he's written a book that you should get. It is called The Patient's Playbook, Find the No Mistake Zone. I'm just going to read to you from the cover. It says, expert advice to help you choose the best doctors, select the right treatment plans, do better online research. Oh my gosh, I got to ask him about that. Organize your support team and prevent medical errors. And he's been featured on PBS. Dr. Leslie Michelson, good morning, sir. How are you?
Good morning, Larry. How are you?
I'm okay. Where are you calling from?
I'm in New York today, and I have to tell you, I'm not a physician, but I've spent my entire career helping people who are not physicians learn how to partner with their physicians to get the very best outcome.
Okay. Well, I apologize for tagging you with the doctor label. I don't know why I thought that.
Okay.
It doesn't say it in my notes. I guess I did it without thinking. I've been a pretty healthy guy all my life, but earlier this year, I started getting this issue with my legs. Long story short, I had the best people tell me who the best people are, because otherwise I wouldn't have known who to go to. In other words, I started at the emergency room, and they told me to go to this doctor, and they told me to go to that doctor. And so just to let you know that maybe I lucked out, I don't know, but I really had a good result at the end.
Well, I'm so glad to hear that, but a lot of people don't, frankly.
Yeah.
And I'm so glad that you did, because you can't leave it to luck. You can't leave it to chance. It's too important. The consequences are too great, and the error rate in the healthcare system is too high. Look, I love our healthcare system. We have the very best medical care in the world in the United States, but our error rate is unacceptable. We all know the two most common causes of death in the United States are cancer and heart disease, but what very few people realize is the third leading cause of death in the United States is actually preventable medical error.
Oh, no.
So I wrote the Patient's Playbook to teach everybody, every person, regardless of their income, their health, their age, anything else, how to become a more effective healthcare consumer so they don't become one of those statistics.
So do we ask more questions, or I've always heard this, that if you're in the hospital, a loved one should be there all the time and should be just asking questions to the point where they feel like they're being a pest. Is that true?
Well, you need to have somebody with you. Hospitals, it's such a paradox. Hospitals are life-giving institutions, but they're also dangerous places. And the way to minimize that danger for an individual is to have a quarterback with them who can guide them. There's no reason to become a pain. There's no reason to ever be disrespectful. And what we model, and we tell stories very specific, we give very specific guidance in the Patient's Playbook as to how to become the right advocate for an individual. Knowing which questions to ask, who to ask them of, and how to incorporate the answers, and to make it easier. You see, the physicians I know, and I'm sure the ones you know, and the nurses, they're hardworking, dedicated people, but they frequently don't have the time and the resources and the systems to provide people the excellent care that they all aspire to do. So my mission is to tap into that reservoir of over 300 million Americans, all of whom, at one time or another, become patients, and tap into that expertise, that energy, that creativity, so they can partner with their physicians, partner with their nurses, and get themselves better care. Avoid the mistakes.
On the cover of the book, it mentions online research, and I wanted to ask you a sort of a related question. One of the things we can research, in addition to what the heck is wrong with me, you can research like on Amazon where they rate a book, or they rate we have Yelp and things like that, where people rate doctors and they rate hospitals. And I've often thought, well, you can skew that information just by one disgruntled patient could say something really bad, give it 1 star, and it could really knock everything out of whack. So is that dependable, that kind of stuff, as far as...
Well,
yeah.
It's a very good question, and there are terrific online resources, but like everything else online today, there's some really high-quality stuff, and there's some stuff not so much, right? Mm-hmm. And what I try to do in the Patient's Playbook is distinguish between those two different categories. So there are some tremendously helpful sites that have objective, meaningful information about physicians. So let me give you an example. There's a terrific website called expertscape.com. It's free to everyone, and if you have a diagnosis, diabetes, breast cancer, lung cancer, a herniated disc, you can go into expertscape.com, type in that diagnosis, and instantaneously it will identify you the preeminent physicians who've done the most research on that condition. And then you can just say, if you happen to be in Florida, or you're in Miami, North Florida, wherever you are, you can just constrain the search to that part of the country, and you'll immediately be able to identify the people who've done the cutting-edge research on it. Now, that's objective, that's legitimate, that can't be skewed, and it's a good way to find a high-quality physician for you.
Sometimes physicians are, most of them are very, very humble. How are they able to share all of that information with the public without feeling that they're boasting or bragging?
So if you're advancing biomedical research, that means that you're publishing in peer-reviewed journals. So what Expertscape has done is it's gone into all of those journals, it's abstracted all of the articles, it's given quality ratings to the journal and the article, and then it's summarized them so at least you can know the people who've been doing the cutting-edge research. So it's an objective source. There are other ways to find high-quality physicians. We Americans are incredibly philanthropic people, and there's a disease-specific philanthropy, or many, for every specific disease, right? Because we all make generous donations. And most of those philanthropies have expert advisory boards of the leaders in that disease. So just by going on to the website and finding out who's in the expert advisory board will give you a very important indicator of who's committed to this cause and who's got credibility. Oh, wow. Many of them also have resources to help. And again, all this stuff available, free of charge. So let me give you a terrific example. There's a wonderful philanthropy called PanCan. It's the Pancreatic Cancer Action Network. They have a group of what they used to call pals there, who are advocates for pancreatic cancer patients. It's free of charge. You just need to go into their website, pancan.org, and say you need some help. You'll get a call back in 10 or 15 minutes, and you'll have a passionate, compassionate expert in pancreatic cancer help guide you through that journey. There are so many resources available for people. They just aren't aware of them. So we made them available. I did in the Patient's Playbook, which is now available in paperback. And you can go on to my website, patientsplaybook.com, for more information. And we even have podcasts called the No Mistake Zone that teach people how to get into what I call the no mistake zone, which is where you can be confident you're going to be safe, you're not going to have errors, and you're going to get cared for by the very best physicians.
I like the fact that you said that a person will have a return phone call within 10 to 15 minutes, because sometimes people get frustrated. They call a phone number, it's a recorded line, it takes forever to get to a real person, and then if you have to leave a message, you don't ever know if they're going to call you back.
Right. And particularly when you're sick and time feels very different, it's so important to get that phone call back. And there are other organizations like the Prostate Cancer Foundation, PanCan. Lots of those are available to people.
Really good information.
And there are people there waiting to help you. Give them that opportunity. That's their passion.
The book is called The Patient's Playbook. We need to take a break, but when we come back, I want to. There's so many more questions I have. Leslie D. Michelson is on the phone. I was calling him Dr. Leslie, but you are actually an attorney, correct?
Correct.
Okay. And this is to help you. I just went to Expertscape, by the way, expertscape.com, and I was looking up my leg condition, and sure enough, we have some people right at the University of Florida that are experts in this. All right, so we'll take a little break. This is really good information. At the end of the interview, I have a copy of the book I'm going to give away, and we'll also give you information so you can go buy the book, because that applies to everybody except for whoever gets this one. Let me take a little break, and we'll be right back with Leslie D. Michelson. We'll be back in a second.
The weather is brought to you by myfwc.com. Safe boating is no accident. Coastal flood advisories remain in effect into the evening at the beaches. Watch for rough surf and dangerous rip currents. Tuesday will start with a morning shower, otherwise a mix of sun and clouds with a high of 84 to 88. And Tuesday night will be partly cloudy, lows in the mid to upper 60s, inland 72 along the coast. Wednesday, partly sunny, high 83 to 87. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
On this episode of What Not to Do, brought to you by
Mike's Got Plumbing. If water runs through it, we do it.
I love vacations, but it's good to come home.
Is the pool overflowing?
We don't have a pool, and even if we did, it wouldn't be on the second floor.
Oh.
I told you before we left to turn off the water main.
I thought you said take down the weather vane.
We don't have one of those either.
Yeah, I was wondering why you said that. It does make more sense now.
Okay, genius, don't just stand there. Cut the main water off.
Okay, I'll go get the chainsaw.
Wait, what? No! What do we do when there's a plumbing issue?
Oh, I got this one. I'll be right back.
I said no chainsaw. Shut the water off and call Mike's Got Plumbing.
Of course, I definitely was not going for the blowtorch.
Uh-huh. The number should be etched in your memory, but just in case, 866-314-4443.
Okay, got it. 866-314-4443.
on next week's episode of What Not to Do.
Really? A mariachi band?
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
Veterans are the foundation upon which our freedom is built. Listen to The Source, WOCA, each Thursday at 9 a.m. to Veterans News with Hank Whittier from Vets Helping Vets. You'll hear tributes, information on veterans issues, and stories that will make you laugh, cry, and feel proud. Veterans News always focuses on the military, past and present, and on our first responders. Veterans News is brought to you each week by Bob Wine's Camellia Gardens and Nursery, keeping you blooming since 1952.
A young woman contemplating having an abortion is told by society that whether she has her baby or not, it is her choice. The House of One in Faith in Ocala wants to give that young woman a place to live in comfort during her trying time, to help her know that God's love is abundant and that He is not ashamed of her in any way. The House of One in Faith is free and confidential. For more information, call 352-687-8895.
All right, 10 minutes before 11 o'clock. Thank you for tuning in. Nice looking Tuesday morning. If you are alive, then you need the Patient's Playbook. I was just looking through this book. I mean, you really are giving good information. So I wanted to ask you if we can do it backwards. Like, can you say, okay, well, let me rephrase this. If you don't have a primary care physician, can you look up the primary care physician you're thinking about and then go backwards and see, is this person going to be good for me? Can you do that?
Sure you can.
Okay.
And we lay out in the Patient's Playbook and information on my website, patientsplaybook.com, techniques to find an excellent primary care physician. And that's the person that needs to be the quarterback of your healthcare team.
Yeah.
So what I recommend people do is it's a simple 3-step process. Step 1, take out a piece of paper, write down what's important to you about a primary care physician. Is it being in network? Is it office hours? Is it location of their office? Write down what's important to you. Step 2, and people don't do step 2. Talk to friends, coworkers, colleagues, other physicians who you like. Ask them who they use for a primary care physician and how they feel about it. 9 times out of 10, your primary care physician is somebody who's treating somebody you know and like, and that's going to be a fit for you. And then you need to make sure that they don't have any sanctions against them by going to one of the websites that we cite on patientsplaybook.com and in the book. And then last, and here's the key, and it's important, make an appointment to interview the physician. Take 15 or 20 minutes. This is someone who should be a long-term health partner for you. You would interview a babysitter, you'd interview a nanny, you'd interview an administrative assistant, you'd interview for everything else. It's important to interview a physician as well because chemistry matters in that relationship. And the only way you can tell is by being face-to-face. And when you do that, you're going to find the doctor for you, someone who'll make sure that you get the latest developments in early detection and prevention, somebody who's going to be your partner no matter what happens to you.
And that's where social media can come into play too, because people have relationships with friends they've lost touch with over the years, and made new friends through social media. And sometimes just a question like that will spark answers from people that you would least expect them to have an answer to.
Absolutely, because there is somebody in your network, right, who has a primary care physician who they're crazy about, who would be perfect for you. You just don't know it. So ping your friends, find out, get the recommendations, and you'll be doing everybody a service.
The experience I had a lady doctor, and whatever prejudices I had about lady doctors was completely washed away. And I don't know that I'm admitting I had prejudices or not. I just don't know. But when I would imagine a doctor, I would always imagine a man. So, But this lady was so good. So and in fact, when she took she went on a vacation during my treatment, it was like 2 weeks, and I only went there once a week. So, but anyway, so there was a guy, and he was outstanding also. But I was like, oh my gosh, are you sure you're going to be?
Right.
In my own mind, I was wondering if he was going to be as good. Find the No Mistake Zone. This book. Can I just say this? It's only $16.95, $17, and you're going to really be better prepared to navigate your healthcare needs and find the doctors you need. Do you know what always happens? We have Robert and I do interviews with doctors regularly, maybe at least once a week, right? Mm-hmm. And so when the doctors come in here, they typically have something specific they want to talk about. This morning we had somebody talking about stroke. Okay. So that particular doctor, I'm sure, has more expertise than just stroke, but that's what he was talking about. So if you were listening and you knew somebody who had a stroke, you might write his name down and call him on later on. But I think the book is going to help you find so many more than what you might just happen to hear on the radio. I think that's the problem we have, is that we don't have enough resources, but this book kind of helps you get those resources.
It helps you get the resources, and it doesn't leave it to luck. Just the chance that you might be listening to your terrific radio show when you have a stroke expert and a friend who might have a stroke in the next 3 days.
Right.
That's just too much chance for me. Our health is so precious. There's nothing more precious than our health and the health of our loved ones.
Do you know what?
And I spent years writing this book, developing the teachings in it so that everyone can preserve their health and learn how to benefit from the remarkable advances that are happening today.
Or an extreme example that maybe not too many people can relate to, but an extreme example, although we do know a lady who had a child, and they had to take the child, I think, was it to Philadelphia, Robin?
Yes.
Okay. And so there's an expense for the mom to get from here to Philadelphia, and guess what? There was a program to help pay to get her not only to the hospital in Philadelphia, but also to have a place to stay, a hotel or something.
Mm-hmm. Yes.
Okay.
Yep.
Does the book help you navigate that part of it? That's not medical, but it's an important element. Otherwise, the child wouldn't have been taken care of.
That's just a very poignant story. And a lot of children's hospitals have relationships with what are called Ronald McDonald houses, where they put up the family while a precious child is being treated at one of the children's hospitals. It's a great program. Well, what we talk about in the Patient's Playbook is that it does not necessarily cost more to get the best health care. Let me explain that. We all know that the finest hotel rooms and cars and suits and wine, they're all reserved for the one percenters because they're very expensive. Mm-hmm. But in healthcare, in sharp contrast to the entire rest of the economy, there's really no meaningful relationship between the cost of care and the quality of care. So if you have good health insurance, employer-based health insurance or Medicare, in every one of those policies, the major academic medical centers in the nearest city to where you live are very likely to be in-network. And if it's in-network at one place, it's not going to cost you any more than in-network at another place. So what I encourage everybody to do if they have a significant issue is try and find an in-network major academic medical center with a specific physician who's focused his or her career on that condition. And when you do that, everything gets clearer. We had a situation of a 35-year-old woman who was diagnosed incorrectly, and then we got the right diagnosis of a metastatic melanoma. Now, that's an aggressive skin cancer. You guys in Florida, so you're familiar with those.
Yeah.
Yes.
And she was 35 years old.
Gosh.
We got her to a world-class expert at a major academic medical center who was in-network for her insurance, who had been one of the leaders in advancing research for the treatment of this disease. He put her up on a clinical trial, so she didn't have to pay anything for the medications. And over a period of a couple of months, her disease dissolved, and we're now years out. She is the picture of health. She has no evidence of the disease. She has to go in every couple of months for an additional infusion.
Gosh.
But the care isn't costing her anything more than her deductible. She's getting the very best quality in the world. No one could get better care than she's been getting, and it didn't cost her any more.
Wow. Let me give the copy away that you sent me. It's called The Patient's Playbook. I also want to encourage listeners to go to the website, patientsplaybook.com. Leslie Michelson, I went there, and I can enter my email address, and you will send me a 6-step guide in my email box or something? Is that how that works?
Absolutely. We'll send you the 6 steps to getting to the no mistake zone. It's the process that I've developed over the years to ensure that each and every person can get the very best medical care and not become one of those terrible statistics of somebody who's been harmed or even worse by a preventable medical error.
And also, you have in your book some of the personal stories. One of the that you had just told, and sometimes that can be the moving factor to a person deciding that they're going to take care of themselves by reading a personal story.
And it's true. They're inspirational stories of real people who've been compelled to confront tough medical issues, and based on the guidance I've given them, been able to figure out how to get much better outcomes.
Can we buy the book on the website, or do we go to Amazon? What's the best advice you have for that?
So the book is not available for sale on the website, but there are links to lots of online sellers, and the book is now available not only in paperback, but in Spanish as well.
Oh, wow.
So you can get it in hardcover, paperback, Spanish. You can get a Kindle edition, and there's also an oral edition as well. So you can get it wherever books are sold. We also have a podcast called The No Mistake Zone. So if you listen to podcasts, download it. You'll find some very interesting information about patients and the ways in which they have struggled and figured out how to get the very best medical care. And go to our website as well, patientsplaybook.com, for all sorts of additional free information.
Wow. Leslie, thank you for what you're doing. This is an awesome book. Nobody called for the one I have. Call me. I'll give you the book away. Leslie Michelson, thank you for being on. Go to patientsplaybook.com and sign up for the email. Thank you.
Larry and Robin, thank you.
You're welcome. We will be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Fox News Radio, I'm Lillian Wu. Hillary Clinton and